What do we do about it? Early and aggressive insulin resistance should be recognized and treated. Insulin resistance is the metabolic engine driving much of cardiometabolic disease, and it develops earlier, faster, and lower body weights in Indian women. South Asians are 2 to 4 times more likely to develop type 2 diabetes compared to individuals of European ancestry. Even more striking, they tend to be diagnosed 10 to 15 years earlier. By the age of 50, studies from urban India show that nearly 40 to 50% of women have either diabetes or prediabetes. This prevalence is not limited to urban or affluent populations. It spans socioeconomic strata and geographic regions. What makes this particularly dangerous is that Indian women often develop cardiovascular disease at lower glucose thresholds than other populations. In other words, a blood sugar level that might be considered mildly elevated or even acceptable in another group can cause significant cardiovascular risk in South Asian women. Unfortunately, traditional screening approaches like fasting glucose alone or delayed testing often miss early insulin resistance. Many women are told that their labs are fine until years of silent metabolic damage has already occurred. Pregnancy can sometimes be the first warning sign. For many Indian women, pregnancy is the first time metabolic vulnerability becomes visible. Rates of gestational diabetes are 2 to 3 times higher in Indian women compared to many other populations. This is not a temporary inconvenience of pregnancy. It is a powerful signal of future disease. Up to 50% of Indian women who develop gestational diabetes go on to develop type 2 diabetes within 5 to 10 years postpartum. Yet, follow-up care is frequently inadequate. Once the pregnancy ends, so does the monitoring. Women are told the diabetes resolved with the pregnancy, even though the underlying insulin resistance persists. This represents one of the most missed opportunities in preventive medicine. Pregnancy is a metabolic stress test. When the system fails that test, it should trigger long-term surveillance and intervention, not reassurance and neglect.